Hello, welcome to yet another video of Acharya Nidana Academy. In this particular video, we are going to expect or learn application of Rogamarga. In the previous video, we have learned how to understand Rogamarga. In this particular video, we are going to learn how to apply those informations. Before that, let us know about some of the basic concepts that we are going to learn as usual. First, if you know about the physics, chemistry and biology and fundamentals of Ayurveda, then every information of the Ayurveda can be learned with the deepest understanding. Second, whenever we are going to learn Ayurveda, we have to practice the concept of minimalism. Minimalism is one particular topic we have to take, and from multiple angles we have to look that particular topic from the point of Padartha Vijnana, from the point of Kriya Sharira, from the point of Rachana Sharira, from the point of Roga Nidana, from the point of Kaya Chikitsa, from the point of Panchakarma, etc. From multiple angles we have to look into that. Then we can have a deepest understanding. Third major point, if you know about the Kriya Sharira concepts very well, then learning Roga Nidana is not at all a difficult thing. It's very easy. And we are knowing the each and every corner of Roga Nidana, then practicing Kaya Chikitsa is not at all a difficult thing. It's very easy. Fourth, whenever we are going to learn of the Ayurveda or any of the information, that is, we have to try to look for the patterns. Pattern identification is very important, so that we can modify the pattern which may subside the illness, and which we can able to create the pattern, so which can help in speedy recovery. Let us say, for example, if a person is taking sour buttermilk from the past 10-12 days, for example 200 or 300 ml of sour buttermilk added with green chilli and salt, if he is taking, that is responsible for the vitiation or abnormal increase of pitta dosha to the maximum extent. In that particular situation, so we have to immediately stop the consumption of sour buttermilk added with salt and green chilli, which is responsible for the immediate subsidence of the symptoms of pitta dosha there. And pattern creation, so that we can able to or a person should be consuming the freshly prepared buttermilk without adding the green chilli as well as salt. This is about the pattern identification and pattern modification and pattern creation. And fifth one, no compromise will be considered in learning Ayurveda fundamentals. And whenever we are going to learn the Ayurveda with the point of Western informations, so we have to take Ayurveda informations as per Ayurveda only, and we have to take modern information from the modern point of view. Then we have to look into those informations at regular intervals, connect the informations at regular intervals. If we are able to understand each and every step, first step, second step, third step, then we can able to say we are moving in the right direction. So that means whenever we are going for learning the Ayurveda, we have to look into that just like learning a new language. So that means more frequently used words has to be learned at the earliest, then less frequently used words has to be used. And some of the other concepts which are based on the Rogamarga concept, they are, all the diseases are being manifested in the body due to the abnormal digestive fire or poor digestive fire, or for all the rules there are exceptions. That means physical trauma, wherein initially the poor digestive fire may not be observed. That is the first and foremost concept. Second, whenever the doshas are abnormally increased, initially that will be moving from alimentary canal to the intravascular compartment, interstitial compartment and intracellular compartment. This is where the commencement of pathogenesis occurs. So that is the initially the dosha increase, abnormal morbid bioenergy is going to get increased in the alimentary canal because of the poor digestive fire. Third, depending upon the presence of symptom and severity of the symptom and distribution of the symptom, morbid dosha may remain in either one Rogamarga or two Rogamarga or all the three Rogamarga. Ayurveda says there are basically three types of Rogamarga. They are Abhyantara, Bahya and Madhyama. Depending upon the nature of the clinical manifestation, depending upon the exposure of the etiological factor, depending upon the severity of the symptom, there may be a possibility of variation. And fourth, context is more important than content. Context is more important than content. Where and all this can be applied, that is very important when you than content. And fifth, practice the concept of minimalism as we have discussed earlier. Then, why Rogamarga knowledge is very important there? First of all, to know about the Nidana and Rogamarga. For example, if a person is taking abnormal, or do you say that the curds, sore curds continuously, that means initially the disease manifestation may begin at the alimentary canal. Suppose if a person is exposed to the, what do you say, that cold water, definitely, so that is having an impact on reduced digestive juices in the alimentary canal, that may further lead to slower peristaltic movement. So that is what is considered to be the application there. Second, extent of the disease. Depending upon the clinical manifestation, we can able to predict the which are the Rogamarga they are being afflicted there. So we are going to know this in the coming examples there. And third one, it is curability and incurability of illness can be predicted. Suppose if the person is having the illness only related to Abhyantara Rogamarga, then it is comparatively easier to cure. If the person is having the Bahya Rogamarga involvement, that will be comparatively difficult to get cured when you are comparing about the Abhyantara Rogamarga. Because in Ayurveda, the elimination of dosha should be done from the alimentary canal. Elimination of morbid dosha should occur from the alimentary canal. So, if the person is having the presence of pathogen in the Madhyama Rogamarga, then it is even further difficult to cure, because that is very deeply embedded in the Madhyama Rogamarga there. And fourth one, planning the treatment. Planning the treatment in the sense, Ayurveda says we have to eliminate the dosha from the alimentary canal or Abhyantara Rogamarga. That means in the form of either vomiting or emesis or purgation or otherwise through the medicated enema administration. That is about the planning the treatment there. As the recap, Abhyantara Rogamarga is nothing but alimentary canal, the extent of that from mouth to anus, and Shakha Rogamarga intravascular compartment, interstitial compartment, and intracellular compartment, and viscera and marma from outside the bones there, joints and marma or viscera, they are being considered to be Shakha Rogamarga or Bahya Rogamarga. And intravascular compartment, interstitial compartment, and intracellular compartment inside the bones, joints, and viscera and marma, they are being considered to be Madhyama Rogamarga. So we are going to have three different examples. In this particular image, that is being there is a small incision that is being observed just in the above the umbilicus as well as below the umbilicus. So that is indicative of some kind of the surgery that has been happened in the abdominal region. Probably this may indicate the alimentary canal that might be afflicted there. So that means, so here morbid dosha might be present in the Abhyantara Rogamarga there. Let us give one more example here. So here the person is having the skin manifestation there. Dryness of the skin is very evidently being seen. So that means, so here the disease is being present in the intracellular compartment. So of course the presence of pathogens is may also be present in the interstitial compartment as well as intravascular compartment also can be observed here. But here when you think of this particular clinical manifestation where the person is having skin lesions, it may indicate the Bahya Rogamarga. So third point, so that is where the person is having very severe joint pain, knee joint pain. So that may indicate it's a Ayurveda says it is the uh, Asthi, Marma, Sandhi, etc. They are being considered to be Madhyama Rogamarga parts. So here as the person is having knee joint pain, that is considered to be one of the Marma as well as the joint as such Sandhi. That means it is very difficult to cure. So when in general practice the persons who are having these single disease manifestations or the single manifestations are usually less common. So more commonly we can observe multiple Rogamarga involvement. So that means the person who is having abnormal digestive fire, he may have the skin manifestation also, and he may have joint disease as such. That means joint pain also may be observed there. So that means multiple uh, Rogamarga affliction can be observed here. Multiple Rogamarga affliction can be observed. That is why it is as the age is advancing, it is a little bit difficult to cure. So that why? Because the Ayurveda says the line of treatment should be from either Bahya Rogamarga or Madhyama Rogamarga. We have to bring the dosha into or the alimentary canal. So that is why it is comparatively difficult to cure. So the take home messages from today's session, it is knowledge of Rogamarga helps in predicting the site of illness. As such, that is being mentioned. If the person is having the pain in the epigastric region, that may probably say that the person is having Abhyantara Rogamarga there. If the person is having the skin manifestation, Bahya Rogamarga. Joint manifestation, Madhyama Rogamarga. Helps in predicting the curability and incurability of an illness. So, knowledge of Rogamarga helps in this particular phenomenon. Let us say, for example, if the person is having the pain in the epigastric region and knee joint pain, when you consider the pain in the epigastric region, it may be little bit easier to cure, whereas pain in the knee joint, it is very difficult to cure. So that means it may take more amount of time to, or sometimes even lifelong medications may be necessary there, and helps in the predicting the probable management of the disease. Rogamarga knowledge helps in predicting the probable management of the disease. So that means line of treatment should be to bring the dosha from intracellular compartment to interstitial compartment to intravascular compartment, and intravascular compartment to alimentary canal. From there, depending upon the area, we have to administer either emesis or purgation or medicated enema. And if the causative factor is identified, then it is easier to predict the reversal of the disease. If you are identifying the causative factor which is responsible for the disease, wherein the different Rogamarga affliction is there, then it is very easy to predict the probable reversal of the disease, or even it is very easy to predict the events that can observe in the subsequent days. That's all for today. If you are really getting the value information, then mention below what are those key informations that you have taken from today's session. If you want to have some more descriptions from this particular academy, mention below what would you like to have the informations from the Acharya Nidana Academy. And if you are liking this particular video, then please subscribe this particular channel and spread this particular in videos to the maximum number of people, so that we can make a message into movement there, so that we can have the very deepest understanding of the Roga Nidana, in turn deepest understanding of Ayurveda. Thank you.